Okay, ma'am, first of all, happy National Doctors Day. Ma'am, mohan janis na kumna patient do like man root thage no libi tahan ido situation na accepted apni khan la towards doctors khan de do root behavior bi dikhai dena to ido khan ido difficult times te apni khan king handle korne la.
Okay, that's a good question. Like, ami khan to it's kitiawa on a daily basis ami laga doctor khan to bishi stress tension te thage, especially ami khan laga Dimapur de to iman cosmopolitan, everyone mixed. So we also we try to among ourselves we discuss and then how to remain calm. Like we don't have classes and all, but then ami kan be lok paile we try our best to tell them to just keep a calm mind. And after so many years of studies, ami kan be everyone is not young, so young. Everyone is matured. So I think my doctors handle the situations very well, and we don't have very hot-headed doctors also. And with Amikan Laga experience to all the doctors here in Dimapur are very level-headed, and we never heard any incident where there has been a fight or an altercation with the patients. Patients have not left unhappy with the doctor or the staff on duty. Of course, they may, some people come with bad intention, taking video and all, which we are trying to restrict now. We today amikhan laga emergency room te bhi no videography koi kene ase, because amikhan to without realizing they put it on YouTube and all, and actually it is not good because it unnecessarily flares up the situation. Ami laga doctor Kantu, they are capable of doing their job. So I think we should leave it to them and not let the public interfere, and let them do in their work, because manu bishi ahile doctor can be tension hoy. So we request the nurses to tell the attendants to stay outside and let us treat the patient if they are in a serious condition, and when necessary we'll call the attendants or the relatives. So I think public also should be aware that they should, since they have come to the hospital, they should leave their patient in the capable hands of the doctors and the health workers.
Okay, ma'am, ido Jan Ashwadila ito opore public hang ito case Europe janai diwo.
Itu amikhan laga Jan Ashwadi itia talk to awareness to bishinai. Itu amikhan laga Prime Minister Modi laga itu initiative ekta bara. They have started this very subsidized drugs. Amikhan dikha nishna ekta dawai 20-30 toka ho kolibi, it cost us 10 rupees. Something the patient would have spent 100 or 200 rupees. If they bought the branded drugs, they'll just be spending 20-30 rupees, which is a very big difference. So I think Amikhan ke they've also assured us that this quality assurance, quality to thik ase itu kane Amikhan bi itia to government set up there. We are trying to promote this Jan Ashwadi. This itu kobo koili to government Amikhan ration card pa nishna na itu type de dawai laga itu ration card, but without the ration card everything is so subsidized. The public should realize that itu Amikhan kumti chawul dam pa nishna na dawai bi itu kumti dam para government dia se.
Okay, ma'am, mohan apni ko isna ido committee damba pai ase ido dawai khan to doctor prescribe korna janalo na ido dawai ro karne ido ration card panai na ido isna banawo lage.
No, that is ido ration card mo example dia hi ase, like sosta para pai kwa laga he moi ration chawul laga kwa ase, nole you don't need card, you don't need anything. Doctor he prescribe kuri dibo and you can buy it in the pharmacy. Aru nutritional supplement inega khantu prescription no holibi ahigine mangile itu tu di dibo. You don't need a prescription. Amikhan ajikali we are trying to not give drugs over the counter money ne khushi patient ahigine mangana. We are also insisting on doctor's prescription, because ajikali amikhan drug resistance can be bishi hoya ase, means dawai khali bi itu kam nakura laga na itu danger ase, itu kane amikhan tu itu discourage kurubo kane prescription tu lagibo. So the doctor, if they write the drug, then the pharmacists will give. इनका से
मैम इदो जन औषधि मेडिसिन दो डिस्ट्रिक्ट हॉस्पिटल दे पाओ ना प्राइवेट खान दे भी पाओ ना इदो
ना इटू तो हॉस्पिटल दे पाबो इटू केंद्रा तो दैट्स व्हाई दे आर ट्राइंग टू इटू awareness dibole mona say because they other people private people also can start a jan ashodi kendra in the town or village or something but itia talk to iman bishi aware honai amikan na like other parts of India so at the moment amikan to district hospital de paise but if there are some private takers they will be willing to give Jan Ashodi store to them, like qualified pharmacists like that na. Those who know bee farm can itu license, probably qualified can do. They will be able to get the drugs. I think you can ask the person who has come from Jan Ashodi how to go about to get a Jan Ashodi Kendra. But at the moment though, we are having only in the district hospital. But the public also are not aware about this. So what the doctors, that's why actually we are also trying to let the doctors prescribe because as you know in the hospital, middle or lower class manu hai here to we want to give them affordable because dam wala dawai dile, they'll eat 1 day, 2 days and they'll stop. So this Jan Ashodi is a very good way in which we can see that the patient gets complete treatment. That if they are prescribed 5 days, 7 days, they'll take it. Nohole bishibar amikhan bhi dikhe that because they cannot afford, they'll just buy for 1 day, 2 day only. So this Jan Ashodi, if they buy this drug, it is a very good way to prevent drug resistance also.
Ma'am, last question. Through this National Doctors Day, what message do you want to convey to the public or to the viewers?
Oh, I would love to tell my public to please love your doctors so that they will be happy, not only healthy, but happy to treat you all, the people. Okay?
Good day to all of you. Thank you for giving me the time. It's good to see faces that I've been hearing about, but then not seeing the faces. Now I can put some names to the faces. So it's good to see all of you. Like the MS had said, we don't spend enough time together, so we don't know who is who. We hear about each other, but we don't see each other. And so I think this is a wonderful opportunity for all of us to get together and meet and share our opinions, share our views, and try to forge friendships, because I think it's very important that we live as a family. We should remember that we're all in the same, we're all doctors. We should be like a family. We should be really strong. The bonding has to be there. And so unless we meet and take time out of our busy schedule and actually give a little bit of time to our fraternity, I think that way we will be stronger and we will be able to project whatever the things that we need. Following on this Jan Ashodi, I think this is something that is really, I've been vouching for it. I've been telling the MS as well that this is something that we should really advocate. When I was there at Molchung, both as MS and then after that as CMO, we built up the Jan Ashodi store. We had seen, took feedbacks from patients, those who were taking from there, and likewise, so it was not something that we just went into blindly, but then we had taken a lot of opinions, even patient feedbacks on what the different, those that were given the Jan Ashodi and those who had bought from the market, and then those that have come back to Jan Ashodi and then tried the Jan Ashodi products. And so that way we've had a lot of very, very good reports and very good feedback where Jan Ashodi medicines were concerned. And so I think none of us should have any apprehensions about it. And so like I already mentioned, if there's any doubts, then quality check can be done. And that can be done not only through, but then even through the pharmacy wing in our department. So that way, quality checks have been done just randomly. We had also selected and then sent for quality check. And it has all come out to be at par with the other drugs. So this is something that I can very easily vouch for. And that way, we were able to really advocate it due to patient feedback. It was not because of the doctors writing it, but because of the patient feedback. And then the satisfaction they got out of it. And patients coming from, after they've been seen outside from the clinics, coming down to the Jan Ashodi store to ask whether they had the medicines in the Jan Ashodi store or not. And so it was that much faith that the public had where Janashuri medicines were concerned. They would rather buy it from Janashuri pharmacy than from an outside pharmacy. And so these were, and then especially from the rural as well. And so that way our health units in the rural also started, because we were lucky we had the RBF, and so they were given, our health units were given some money for purchasing medicines. And so that way they would come, give the order, place the order in the Janashuri store for their store, and that way they got so much more than, so it was very satisfactory. They could help all the patients that were there, especially in the rural. Whereas if we buy the branded medicines, we may not even get one small shoebox. But then through the Janashuri, they were able to take back cartons. And so that's the difference that was there. And then the action of the medicines were just as good. And so that way, and then the patient compliance, very good. So likewise, I would also request our doctors here, knowing that, as our MS has already mentioned, that this is something that we can put on. I vouch that I'm sitting here vouching for it, that it is standardized, it's up to standard. The packing is not beautiful, okay? It does not have a fancy packing and things like that, but then the quality that is there of the medicine is just at par with the fancy packing that we get from branded medicines. So this is something I think I would like to request, especially because of the patient turnout here. And it will really benefit not only the patients but even the hospital, because from whatever the incentives that come along with how much we have been able to sell, hospital upkeep can be taken care of it, improvement of the hospital setup can be done, little things we can take up with it. In Mokchung, we took care of the annual maintenance for the X-ray machine, for the and for the ultrasound machines and things like that, because we don't get any help from the state. And so these were the things we could do through the Janashuri benefits, incentives that came for the hospital. And so we should not just overlook it, but I think there's so many things we can also think outside the box. And likewise, I think I've said enough about Janashuri.
And we celebrate National Doctors' Day since 1991. We have a Doctors' Day, Happy Doctors' Day, which we celebrate on 30th of March. We have another International Doctors' Day, which we celebrate on the first Monday of October. So we have 3 Doctors' Day, if we say. But the National Doctors' Day in India, which is celebrated most respectfully, is today for our National Doctors' Day. Now,
Mahapatra, joining as a nodal officer for Northeastern states, Manipur, Nagaland and Arunachal Pradesh. I am from PMBI, Pharmaceutical Medical Device Bureau of India, and Pradhan Mantri Bharatiya Janaushadhi Pariyojana. Thanks everyone for giving me a chance to say something here. Thank you all to give your precious time to us for this Doctor's Day. First of all, I would like to wish Happy Doctor Day to all the doctors from my side and from PMBJP side. Happy Doctor's Day to the healers. Happy Doctor's Day to the guardian of health. Happy Doctor's Day to the heroes in white coat. And thank you so much, doctors, for your countless sacrifices. Now I come to the point. I just show you a 9-year journey of Janaushadhi video.
India has emerged as one of the fastest growing major economies in the world and is expected to be one of the top 3 economic powers globally over the next decade. To sustain this growth, India needs a healthy population.
Nagaland TV, Sop Manulaga Awas. Watch us live on Geo TV and on your television sets as well. For Dimapur viewers, we are on channel number 994 in Global Chapter, and Kohima and Mokokchung viewers, switch to channel number 138 on Hornbill Digital. For all news and updates, follow us on Facebook, Instagram, YouTube and Twitter.